work day by day with experts of nanotechnology. So 3 points. So it's in the last years, it's increased so much the papers about the use of nanotechnology in medicine and in sepsis. So it's possible to use different materials in nanotechnology. For example, metals is more common, but polymers, lipids, and if you possible to use of lipid-based nanoparticles, and you remember amphotericin B, liposomal, use this concept for us, no? Sorry. So in diagnosis of sepsis, it's possible to use different materials. So for example, iron, gold particles, different metals particles. It's possible to use or to identify targets such as CRP, PCT, lipopolysaccharides, and of course, use of different techniques. The most common is colorimetry detection, immunocyte, magnetic separation is an example of TEDOS systems that use a magnetic resonance for identify microorganisms, and if possible to view in this slide, the limit of detection depends so much of the technique of the material that you use. For example, the most common CRP is used in different methods, and as you see in TEDOS magnetic resonance, the identification not only candida but others pathologies. So it's possible to understand this detection of sepsis using biomarkers, and of course, it's possible to use optical or electromechanical, electromagnetical, and final, the rapid detection using a microfluid, and finally, one imaging that identify these nanoparticles between different size. So it's one example that use of magnetic resonance for separate is an antibody and this biomarker, and finally iron or gold particles, and use of different methods for identification. So in very, very important, this is a possibility, the fast diagnosis of different microorganisms, for example, E. coli, Pseudomonas, Staphylococcus aureus, in very few minutes, and the possibility to identify the different mechanisms of resistance in the moment in the multi-resistance area is very important. Diagnosis, and our experience in the last 3-4 years, our group published many articles, many publications about the nanotechnology applied in the diagnosis of biomarkers and microorganisms. It's a very nice experience. For example, using a densitometry, using origami with a paper, a special paper with a biosensor, and digital logic using reality amplify. For example, it's a colorimetry detection using one telephone for make a photograph and identify and quantify the biomarker, in this case, the CRP and PCT, in very few time. So this is very simple to understand, to identify. In the last possibility to use 3 different sensors, colorimetry sensors, green, yellow, and red. Is have a positive in the 3 sensors, is had higher value of PCT. This is another study using identified lung interleukin 6 in respiratory samples. It's not easy to manipulate respiratory samples because the macrophages and purulent secretions sometimes in many different techniques is not easy to identify. So it's very few time, in 30 minutes, and after 1 minute using specific techniques, is possible to identify interleukin-6 in sample respiratory. And this is very important because had a close relationship with oxygen, PO2, VO2, oxygen, the close relationship of Earth's severity, the level, higher levels of interleukin-6 is associated of better or not results. So this is a very interesting in COVID-19 patients. I'm more fast. And as you can see, in both blood samples and respiratory and aspirate samples, the COVID-19 is higher in this group of patients. And the rapid detection in urinary tract infections of E. coli in only 7 minutes. If can you see in green is other infection by other gram-negative bacillus, but it's very specific for E. coli in 7 minutes. Or the respiratory samples is need 1 minute for sputum liquefaction. And as you can see in the biofilm, destroyer biofilm to identify Pseudomonas. So as you can see, it's identified Pseudomonas group of patients is a significant. So this using the Pseudomonas sputum using a smartphone to reader is very few time, in only 8 minutes. At the moment we study the different mechanisms of resistance using the same technology. And so it is I think it's very interesting because we identify in the era of COVID-19, identify SARS-CoV-2 antigens in trapped cervical face masks. And this is a technique, is a very similar, very fast. And as you can see, we identify the patients using 30 minutes, only one, the trapped surgical mask, it have antigen of COVID-19. It's interesting because in some patients without with a asymptomatic infection, but identify these patients in this group. Sorry, and the last, sorry, and the last is hypergranulation in using nanosensors. This is patients with sepsis have a deficiency of this degranulation of neutrophils and can to identify very fast using nanoparticles in this group, in the CD18. Okay, thanks so much.
Thank you.